Test, test. Hi, 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 hi. Hello, test, test.
It's all ready to go. I can just...
So you have two.
Also, the age analysis, so we have neurology.
Sue Lomas. It's just not on the internet. It's not connected. Eric. One coming. I don't know. I have no idea.
This is the HDMI. It's in here and it's in here. You're in. Why is it not going? Why is it not mirroring?
Okay. Hello? Does this work? Okay. Everybody come on in. Shut the door. Lock it. Whatever. Come on in. Yep. No, I'm not. We're going to start now. This is just an informal session, medical question and answers with Dr. Curtis and Dr. Ann, and you've met both of them before. But mostly we're going to try to put your questions up on the screen because it's very difficult to run around with everybody's questions and they'll answer them. So maybe we're going to do that. We're not sure yet, but we're working on it. So does everyone just has to open up poll everywhere?
Yeah, it's already running.
Okay, so if you guys can, they'll talk for a second, but if you can get your poll everywhere, and then we want to just answer your questions, okay? It's just a little bit easier when there's multiple people in the room. So, Curtis, you want to just summarize some, do whatever you want to do?
Tell a joke? Oh, okay. I could tell you plenty of jokes, but they're not suitable for a mixed company. So they're going to ask the questions up here. When we did this 2 years ago, I was by myself. I didn't have Ann, and I was kind of in the middle of a ring of parents. It was rather threatening that way. If I didn't get the right answer, I thought I might get tomatoed or something. But so, if you guys will post your questions up here. Yeah, the fastest typist wins. We'll start. Okay. Okay, do you outgrow febrile seizures? I've heard Valium can be good to lower temp. Well, I don't think of Valium lowering your fever, but I'll let Ann handle that one. She's the neurologist.
Okay, so most kids outgrow their febrile seizures, but children who are at risk for seizures or have a seizure disorder. Can you hear me? Oh, okay. He's just waving there.
Yeah, Eric's doing something back there.
So children who have seizure disorder are more at risk when they have a fever or an illness. So yes, you outgrow your febrile seizures because that's just a limited childhood phenomenon. But if you have ongoing seizures after that, you're more likely to have a seizure when you have a fever. So the second question in there, I heard Valium can be good to lower the temperature. Not to lower the temperature, Tylenol or Motrin does that, but Valium can sometimes be given to a child or Ativan for a child who has known bad seizures and then they get a fever, and so the family knows that the kid is going to have more seizures with a fever. So sometimes then we'll give like a couple doses of Valium, or, well, typically Ativan, which is similar to Valium,
Or
just to bridge the gap.
You know, some of our patients have Diastat
Yes.
available, so suppositories of Valium, basically,
Yeah.
if there's a prolonged seizure. And the neurologists give them some ideas about if this seizure lasts over, usually ours say 5 to 10 minutes,
5
and
minutes.
5 minutes, and then give one of these suppositories. Okay? Let's see here. I'm not sure about omega-3 and omega-9. I will tell you this, though. I'm a proponent of trying things as long as there's a low risk associated with that. And I don't think there's any significant risk associated with that. So if you wanted to try that, I'm fine with that. Some people are going to ask probably about mitochondrial disorders, and some people have felt that maybe Phelan-McDermid syndrome has a mitochondrial component to it. Again, I'm not opposed to coenzyme Q10 or carnitine. I'm just not sure it's going to do any good, but I think we've used it thousands and thousands of kids and not had any significant side effects. So I think it's got a safety profile that's good, just not sure of the benefit that you get. Okay, and you...
How often should we be getting CAT scans or MRIs? You should not get CAT scans unless they want to look at the bones for some reason, because CAT scans are a radiation, okay? So CAT scans are needed for certain procedures of the head, but if you want to look at your child's brain, an MRI is better. Like if you're in a car accident, they may do a CAT scan quickly because those can get done really fast, or because your child, they don't want to sedate the child. But otherwise, MRIs are what we recommend, and you don't need to do them serially. You get one, and if it's normal, then you're done.
Do you want me to get rid of that one for you? No? Okay.
Okay. Yeah?
If it's abnormal,
So,
if there's a, the corpus callosum, if they notice that, is that something that you should move forward on? I don't know.
yeah. So if the brain hasn't developed properly, for example, the bridge that between the right and the left side, the corpus callosum, isn't fully developed, we typically don't follow that because it's not like that will predispose you to having fluid on the brain or tumors or something like that. So it's a good question to discuss with your neurologist who did the MRI, whether they think that you need to repeat it or not, because generally you don't.
Let's see here. Seizure meds to avoid. And they're going to ask you this question.
Thank you.
Seizure meds, do children with PMS who have seizures, are the seizures more difficult to control? And are there any better medicines, or are there medicines you should avoid? That's all kind of lumped into one.
Okay, so there are certain seizures that do better with certain types of medications. And there are some seizures that if you give like Tegretol or Oxcarbazepine, for example, the seizures can get worse. So yes, there's certain medicines that are really good for certain types of seizures, and there are other medicines that can make certain seizures worse. So like Depakote actually is a pretty good medicine for lots of different types of seizures, but it requires blood draws and has potential toxicity. So often kids are started on other medicines. So there's no one perfect medicine for seizures. And again, talk with your neurologist because we know which medicines work better for which types of seizures.
So are there any, is there evidence to suggest in your mind that kids with PMS have seizures that are less easily controlled than a typically developed kid with seizures?
Yeah, so more children with PMS have seizures. Up to about 33% of them have seizures, and not many, but not all of those seizures, or maybe more than typically, we have a treatment-resistant type of seizure like Lennox-Gastaut seizures. So those are harder to manage. So some of the children end up being seen in special epilepsy clinics because they need a specialist, an epilepsy specialist.
And that depends on the type of seizure.
Exactly.
And their EEG findings.
Exactly.
Right. Okay. Let's see here. What do I think of Clemson's chances of winning the national championship in football this year? I think they're pretty good, but I'm always confident that way. So, but I'm a dyed-in-the-wool Clemson Tiger, so we'll leave it at that. My son's never give up hope. Hey, we won it once. My son's legs have modeling when he is hot. I think what you're seeing is some vascular instability. And we see that in Down syndrome, for instance, too. It typically is not associated with any problems at all. Yeah, they'll have this reticular pattern on their skin, sometimes when they're hot, sometimes when they're cold. But it is not a sign that there's anything wrong internally, okay? Downside to giving supplements such as zinc per day to my adult child who has PMS. I don't think of any issues with giving that. I think it has a very safe profile, good safety profile. And again, if you take vitamins, you may be taking more than 25 milligrams of zinc in a multivitamin. I'd have to look on mine to see how much is in there. We ask about seizure. Okay, are kids with abnormal EEGs destined to develop seizure disorders?
I can answer it. We just had a discussion
Yeah,
about
we
it.
did. We just had a
If
discussion.
you want to start, you're welcome to.
So Ann and I were talking about this, and families come in, and even when I was in general pediatrics doing that, about 15% of kids and probably adults are going to have an abnormal EEG and never have a seizure. On the opposite side, not everybody who has clinical seizures is going to have an abnormal EEG at a baseline. So obviously the answer is no. Just because you have an abnormal EEG, you're not going to have seizures. Now, I would say that risk is increased, but I don't know how to quantitate that.
Okay, so it seems like an EEG would be really objective because they're looking at your brain waves, but they're not objective, they're subjective. And the person who's reading the EEG, if it's a 2-day EEG, they've got 2 days worth of readings to look at. And if it's a 2-hour one, then they scan through it real quickly looking for abnormalities. Some of the abnormalities might be just minor, but they still call the EEG abnormal. And some of the abnormalities might be really concerning for seizures. So I get lots of abnormal EEGs reports, but some of them I don't do anything with because they're just very slight abnormalities. So technically they're abnormal, but I would never treat it. But if I have a child that looks like they're having electrical seizures, then it becomes more of a question, is the child actually having a behavior that would be a seizure, or is the child losing some skills or not learning the way they used to learn? Then I'd be more inclined to treat.
I think the key to that is nobody's going to treat an EEG. We treat patients. We don't treat MRIs or EEGs. So we interpret those, the neurologist, all of us working together, we interpret those in the context of the patient that we're caring for, okay? Let's see here. Attention and hyperactivity issues, no seizures. Should we try medication? Are we increasing the risk of seizures? So what they want to know is about stimulants and increasing risk of seizures. You take that one.
So there was a big study recently, and it appears that there's no risk of seizures with stimulants. So the thing is that the brains of children with PMS are not like typical kids, and sometimes the stimulants agitate or activate children. They don't work. Children under the age of 7 typically don't do so well with stimulants anyway. So we often will start with a different kind of medicine for hyperactivity and impulsivity in a younger child, or in a child with PMS, or even autism.
But if you're 10 and you're on Ritalin, let's say, have you increased their likelihood of seizures?
No, no.
I've never been worried about giving that medication. My older son was on that medication. So I don't know anything about vitamin absorption issues in PMS. However, I will refer you to Luigi Bacuto's poster, and he talked about there are some individuals who have changes in a gene that can lead to fatty liver, and I think we always have to be aware of the fact that absorption of fat-soluble and non-fat-soluble vitamins can be different depending on your diet and your absorption of fat. That may be unrelated to PMS, but in some rare instances may be. So I think if you're worried about whether vitamins are being absorbed, then maybe you should check vitamin levels, and those can be tested, and you'll know the answer to whether your child is absorbing those. Routine vitamins have been used in megadoses in kids with Down syndrome, and it goes in waves. Like most things in medicine, we'll have a cycle where megavitamins in Down syndrome, the kids had better development than the kids who didn't. That has never been scientifically proven. That is all anecdotal evidence. If a parent came to me and said, I want to give my kid mega doses of vitamins since we know they're safe, I'm not going to say you don't do that, but if you're going to evaluate someone, you've got to have very sensitive testing from a developmental pediatrician or a developmental psychologist to say that. The other thing to remember is, and you guys know this, in PMS and Down syndrome, in most chromosomal disorders, kids make progress. They don't make it as rapidly. So to interpret that and to say how much is due to the vitamins and how much is due to the fact that they were just going to have an improvement in their development with age and learn more skills, that is next to impossible to separate out. So there have been no well-controlled studies in the group that has Down syndrome to say that vitamins help. I don't think they hurt. I'm just saying we don't have any evidence that they help. And I think Phelan-McDermid syndrome will be the same way. You just, that's going to be difficult to prove and very expensive to try to prove that, because that developmental testing is very expensive, and you're looking for small differences compared to the background natural course of what we would expect a child with PMS to do. So that's going to be a tough one to prove.
I'm going to interject one thing there.
Okay.
Vitamin D. Ask your pediatrician to check vitamin D levels, because the kids, if they don't get outside a lot, they're not good walkers, they're not going to do all the banging on their bones that the bones need to grow strong. And we want to make sure that all the kids have adequate vitamin Ds, and most people in Boston don't, especially in the winter.
There's a fair amount of people, when we check pediatric patients for sure, some studies will say 30% of kids are vitamin D deficient. D as in dog, yes.
Yeah.
Yeah, so that their bones are not as strong as they should be. I just looked at a report from an MRI from a person in Australia, and the mom was concerned because her child has some changes that could be consistent in their spine with osteopenia, and it may be because there's a vitamin D deficiency. So that may be a fairly simple thing. Vitamin D, calcium supplementation, getting out in the sunlight a little bit more may help.
And vitamin D comes in liquid drops because the babies get it, so it's easy to give.
It's been 20 years since my son's diagnosis. Should we have him tested again? Depends on which test you had. If he hasn't had a microarray, you certainly ought to have a microarray. You need to know how big the deletion is. That helps us as far as in the registry trying to sort things out. If your child hasn't had a baseline, and Ann may disagree with this, if you haven't had a baseline MRI and an EEG and even a renal ultrasound, I don't care if you're 30 years old, I think those are good places to start, because there can be some things there that could be concerning and it may need to be addressed medically. So from a genetic standpoint, a microarray right now, if they haven't had that done. And since they were diagnosed 20 years ago, if they haven't had any testing then, they didn't have a microarray because we didn't have microarrays back then.
Next one's for you. How should ring patients determine their risk for NF2?
I think that's with constant monitoring, and there are articles out there. Dr. Holder talked from a neurological standpoint, and he has a nice, I think, well-written, fairly simply written thing that can be used, article that can be used to give to your pediatrician, your local neurologist, and say, here's why my child with a ring 22 is at risk for NF2 and how they need to be monitored and what type of surveillance they need. Again, it doesn't matter that the NF2 gene is not deleted. It's the fact that there's a ring. The mechanism is the ring and loss of the ring with the NF2 gene that's contained in the ring. So that's the issue there that places them at increased risk. My child doesn't seem to sweat but gets very red flushed in warm temps. How does this, or does this impact her epilepsy? Other signs of overheating? Well, I'll tell you, you need to keep them cool. You need to make sure if you're going to be at someplace, we'll pick Disney World, that you address those issues. Somebody over here was selling cooling vests. I think those are helpful, making sure you're well hydrated, and making sure you don't spend a lot of time out in the direct sunlight, which you can at Disney World because you're going to have to stand in that stupid line forever. However, this gives me a little leeway here before I let Ann talk about the seizures. All of those places have will make special provisions for children who have special needs. So you need to make sure when you go that you've got that base covered. Now, my next ad is for a nonprofit organization called Give Kids the World, which is located in Orlando, Florida. And you guys and your children could take advantage of that, because once you go through a wish-granting agency like a Child's Wish or Make-A-Wish, they can contact Give Kids the World, and Give Kids the World will organize that whole trip for you. You stay in cottages on their 80-acre campus. You eat there. They have an excellent cafeteria. I worked in the cafeteria. I volunteered there a couple of weeks ago with a youth group from my church. That you can ride horses. They get you tickets to go to Disney, Universal, SeaWorld, any place you want to go And they place a star in the star castle for each wish child, which is pretty cool. So take advantage of things like that, because it's there for you. They're raising money at that nonprofit to host you and your child at their organization. They use 250 volunteers a day. And if you're visiting Florida and you let them know ahead of time, you can go be a volunteer there. I tell you, it is worth it.
What was that group called again?
Give Kids the World. Yeah, you can look it up online. Just put in Give Kids the World. I think it's givekidstheworld.org. But it is an incredible organization. And when we were there, they had children who, they're kids with genetic syndromes. They're children who are recovering or dying from cancer, who were there with their families. There were kids from all over the world that were there at this time. And they can host like 750 people at one time. So it's a big operation, but an incredible operation, and really something worthwhile. We have a couple at our church whose son is one of my patients who has a different genetic disorder, and the mom said, well, we can pay to go down there. That's not the point. The point is to go down there. You need a break. It's a good way to take a break. You don't have to worry about anything. They have medical staff around. I'm just saying it's an easy way to do things. So answer the question about overheating and
Overheating,
seizures.
and I think we have 10 minutes. Is that what that means? Okay.
That's what Nick says.
Overheating, I mean, you really have to overheat to like have a fever, basically, to increase your risk for seizures. Hopefully they're not overheating that much.
So
In
take
Texas,
that
I don't
next
know
one.
when it's 110 out though.
Yeah, take the next one with the
Long-term effects of Oxcarbazepine. Actually, there aren't really any long-term effects. It's not like the old Dilantin that made your gums thick, and like Seroquel, which can cause weight gain and potentially doesn't a movement disorder. So Oxcarbazepine is fine.
The one about not drinking water. I'm not a big water drinker myself, so I like other toxic substances like Diet Pepsi to drink or sweet tea. So I think as long as you get liquids into your child, how do you know how much liquid you need? If your child is urinating, then you're doing pretty well, and your child should be urinating 4 to 6 times a day. And the other thing is, if their mouth is moist, they're making saliva, if they can easily make tears when they get upset, then you know they're pretty well hydrated, okay? So that's an easy way to look at that. Again, it's not water per se, it's fluids that we need. If they like Gatorade, you know, obviously we don't want to give a lot of high calorie, empty calorie things like Gatorade or iced tea that I'm drinking. Okay, let's don't get personal here with my sweet tea. But that's why I have to drink Diet Pepsi so I can drink sweet tea. I think, you know, fruit juices are loaded with sugar, so you just want to be careful about that. Think about what you're giving them. And sometimes you can take the water and add just a little bit of apple juice or something else, and it gives it enough flavor that they think this is great now that you've done this. So, you know, there are ways to get around that. Okay?
Yeah, so I'm going to just make my plug, because juices are my pet peeve, because dental care is always more difficult, and if the kid is constantly bathing their mouth in sugar drinks, first of all, they're getting...
Man, that's good.
Brush your teeth. Yeah, so they're empty calories, weight gain, bad teeth. So if you can just progressively dilute their drink, and it may take 2 months until it's basically water, use the same bottle that they're used to, just pour it in that same bottle, and hopefully you can dilute them down so that they're mostly drinking water, or you can even get them to drink water. Because ultimately, when they're older, you want them to be able to drink water. So you have to teach them when they're young.
Let's see, what else we got here?
Renal
How
exam.
often should a renal exam be done with no abnormalities found in the initial test? I really don't think you need to repeat that renal ultrasound, because if it's a structural anomaly, it's usually there from the get-go. However, one thing that would force you that way would be recurrent urinary tract infections, and I think that's telling you, hey, we've got an issue here. Now, depending on who is wiping a child, since most of the kids are not going to be able to take care of their toileting needs themselves, you need to make sure that you wipe from front to back. That's a common sense thing. You don't want to bring the bacteria from the bowel and the stool up into proximity of the urethra. And again, if you're having recurrent UTIs, which are going to be more common in girls than boys, just anatomically speaking, because the urethra that goes to the bladder from the outside to the bladder is shorter. It's closer to the stool because of the way girls are made. So little girls are more frequently going to get UTIs than little boys. If a boy has a UTI, in my mind, from a pediatric perspective, the first UTI is enough for me to say, that's not typical. We need to take a look, and whether the pediatrician orders a renal ultrasound or whether you send them to the nephrologist for evaluation. You know, for a little girl, typically in pediatrics, we would say if you have 2 or more UTIs, then you need to be investigated, no matter what that initial renal ultrasound may have shown, okay? That's kind of my rule of thumb, just from general pediatrics. Or cataract, what are the best recommendations for girl getting their periods? Woo-wee. One, I think you need to find a good adolescent gynecologist. We're blessed in the town I live in that we have a female adolescent gynecologist, and she is great at working with typically the moms who are going to take their daughter to that appointment for sure. So the moms and the daughters, and coming up with a plan. I'm not going to get into periods and stopping those and things that can be done that way. You need to address that with the adolescent gynecologist, but there are ways to get around things that way.
I think we have time for 1 or 2 more questions.
Yeah,
So,
cataracts. I don't know what the registry says about cataracts. I can tell you I don't remember patients telling me at any increased frequency about cataracts, but I think we'd have to look at the registry and see what that says. But that is not common. And so I think in that case, we need to look for what is causing the cataract, and a very good pediatric ophthalmologist who is well-versed in cataracts may be able to help you figure that out. Again, one of my buddies that I went to med school with happens to be the leading pediatric ophthalmologist in our state when it comes to cataracts and lens replacement. So I call my buddy Ed, and he calls me when he has a genetic question, even though we're on different ends of the state.
sleep. Should kids with sleep disturbances do a sleep study, or is this just part of PMS?
I think because having sleep disturbance may be an indication of obstructive sleep apnea, and any child who has hypotonia, we do this all the time in Down syndrome. We recommend every one of those kids get a sleep study. I think if your kid is having a sleep disturbance, or if they're snoring when they sleep, or if you see them appearing to hold their breath when they sleep. Not only does it terrify you, there is a way to get around this. They need a sleep medicine evaluation with a pediatric sleep specialist. Sometimes those are not easy to do because the child won't go to sleep with all these wires hooked to them because they're measuring their electrical activity in their brain, they're measuring their chest movement, and they're measuring the movement of air in and out of their nose and mouth to try to determine what central apnea, if that's present, meaning the brain and lack of a drive to breathe, as opposed to obstructive apnea, which means that because of the hypotonia, maybe their airway is collapsing when they try to breathe in, and so they're if you know anybody who snores, you've seen somebody with obstructive sleep apnea. You've heard that, okay? It can be treated with positive airway pressure, and it's amazing to me how well some kids will tolerate CPAP. They just have to be trained in that, but the pediatric sleep specialists are very good at helping the families train those kids and finding a mask or nasal pillows that work and can handle that.
I just will say I have one child who wears his Darth Vader mask every night to go to sleep.
Enlarged aortic root and hypertension, obviously you need to control the hypertension because that's not good for your aortic root for any of us. So we need to worry about the blood pressure and get that under control. There are certainly a lot of kids who have PMS who appear to have hypermobility of their joints. So I'm not going to say there's not a connective tissue problem. We just don't know what causes it. So I think you need to be aware of that. Typically, I'll say we don't routinely advise echocardiograms for kids with Phelan-McDermid syndrome, but once your aortic root starts enlarging, you're probably going to have a murmur associated with that from aortic insufficiency, and then that will lead to the evaluation. And there is medical treatment for that. It's not always surgery. So let's see. I think boy, that keeps moving up here. How about lithium?
Oh, risk of being on lithium for long periods? Yes, there is. You can get, they have to check your kidneys and make sure they're working properly, and they also check thyroid to make sure it's working properly. So, and when you're taking lithium, they check lithium levels as well. So you just need to be followed by somebody who's making sure that they're checking those things for you.
I will say for some of the older individuals who had schizophrenia or bipolar-like symptoms, lithium has, in these articles that are reported, usually it's one patient or two patients, that seems to be a good medication to use. Risperidone has helped some families and their kids. So a lot of things in the brain, I hate to say this in front of a neurologist, a lot of things in the brain are kind of trial and error. We make an educated approach to the trial and error, but nonetheless, what works for this child may not work for this child, and so that's why you need a very good neurologist who's going to work with you and your child. You also can't, and Ann will tell you this, you can't put somebody on a seizure medication and then just say, oh, that one's not working, we're going to stop that one. You can't do that as a parent. That has to be tapered and things like that, because you may increase your child's risk for a seizure significantly if you stop medicines cold turkey. So those all need to be considered, and that's why you need a good neurologist.
No, I just think, you know, having tried to find a doctor that listens to you, that's really important, so that they are hearing your concerns and acting appropriately. And don't be afraid to tell the doctor if you don't like something that they're prescribing to your child, because they need to know, and they won't know unless you tell them.
Okay. And if you've got any more questions, I might not get to them for a week or two, but you can email me. My email address is easy. It's just CROGERS, crogers@ggc.org for Greenwood Genetic Center, .org, okay? If you need a letter, a nasty letter written to an insurance company, I love doing that. I'm nice to patients. But that kind of gets my frustration out when I can really slam the insurance. I don't know whether they even read the things, but makes me feel better to write those nasty letters to them.
Thank you, guys. Thanks very much. All right, closing session in about 15 minutes, so get out of here so we can clean it up.